But now we're going to check in with Assemblymember Amy Paulin, a Westchester County Democrat who is in her second year as her chamber's Health Committee. New York Now reporter Chantel Destra spoke with Paulin about Medicaid spending in the budget, her effort to create a single-payer health insurance model in the Empire State, and the future of controversial legislation allowing terminally ill New Yorkers to end their lives with assistance from a doctor. Here's that conversation.
Thank you so much for being here, Assemblymember.
Thank you for having me.
Now, healthcare takes up a large portion of the state's budget year after year. A lot of that has to do with Medicaid. We know that Medicaid spending has ballooned over the last couple of years, largely in part due to the COVID-19 pandemic. This year, in the executive budget, Governor Kathy Hochul has stated that she wants to scale back on Medicaid spending and find ways to save. What is your perspective on the governor's proposal?
Well, right now, the governor's proposal isn't fully formed. There were anticipated unallocated cuts, something we've never seen before, of close to $400 million in Medicaid, which translates into an $800 million cut because of the federal match. So those are not fleshed out. We don't know what they are. $200 million in long-term care and $200 million in managed care, and we just don't know what they are. So we don't even understand what's going to happen in the budget, until some of that's laid out, perhaps in the 30-day amendments.
Mm-hmm. So you don't understand the governor's proposal as it stands. So in what ways are you hoping that the governor and legislative leaders tackle Medicaid spending in the final state budget?
Well, it's a little scary because we know that our entire healthcare system is suffering from a workforce shortage. They're suffering, as you said, post-COVID from a depletion of funds from the federal government. And so we're overloaded, and yet we're deficient in how we're serving people. And we need to rethink a lot of that. We need to shore up our hospitals. We have 75 hospitals in distress. That's 29% of our hospitals in financial distress. That's an enormous number. We have so many on the brink of distress that are pleading with us for more resources. Our hospitals are where we go if we need tertiary care, if we need ambulatory care, we have to shore them up. So that's a big problem. Nursing homes, another tremendous area that we have problems financially with. They're going under. Not-for-profit nursing homes are selling to for-profit nursing homes. We aren't seeing the capital investments being made that are needed. Again, a workforce shortage and not enough resources for these facilities. So it's across the board, and and then we have a tight budget. It's a problem.
Mm-hmm. And were there any measures that were put in place during the COVID-19 pandemic, emergency measures that you're hoping will be expanded to become permanent measures that the state will implement?
Yes. Short answer. Some of the measures that were put in place, allowing some practitioners to have a small expanded scope, allowing nurses to do more than to work at the top of their license, EMS workers to work at the top of their license, and so forth down the line, physician assistants at the top of their license. Those are things that I think that we have to continue to do. They were by executive order, as you point out, for 3 years they worked, and the hospitals are relying on them. Nursing homes are relying on them for us to go forward and to maintain them.
Mm-hmm. And your predecessor, former Assemblymember Richard Godfrey, he was, of course, the lead sponsor and longtime champion of the New York Health Act. I know last year you took over as Assembly sponsor for the bill. And this is a bill that has been, in the legislature, but hasn't moved forward for several years. So what is the path forward for this bill?
So first, for who's, our viewers, right, your viewers, to understand what it is. It basically simulates a model. There's lots of models out there in lots of countries that really make healthcare a right. This bill makes healthcare a right. And it makes it a right so that if someone presents themselves at a hospital, they present themselves at a doctor's office, that they know that they're going to be able to get the health care that they want and deserve. Doesn't rely on high premium payments, and we hope that this bill will be able to become law at some point. We're still working through a lot of the bugs, and we still have to win over some of the unions, but long-term, it's something that we should do.
Mm-hmm. And another bill that you've been championing for is the Medicaid and Dying bill, which would allow for patients who are terminally ill to be able to request medication to self-administer to end their own life. And that bill I've been watching it closely. You've been garnering a lot of support for the bill. A lot of people who were completely against it for religious reasons have actually, changed their mind and shown their support. So how will you continue to garner support for the bill this year?
I think we have the support we need. I do think that this might be our year. I'm very hopeful that we have won over so many of my colleagues. Certainly, we've won over the citizens of New York State, the residents of New York State. The polls show overwhelmingly people support bringing death with dignity to New York, like we did in New Jersey, like they did in California, like they did in Oregon, and in 10 other states. So its time has come. As you said, a lot of my colleagues who were once against it are now recognizing, either through their own personal unfortunate experience with family members or through constituents who have come to them, that it's the right thing to do for New Yorkers. So I have a very high expectation that we're going to see this bill move forward.
Mm-hmm. And turning to reproductive rights and abortion access, New York has codified abortion access in the days after the overturning of Roe versus Wade. And Democrats have made this a top priority year after year since 2022. So how will the Assembly continue to expand on abortion access? I know in the Senate earlier this month, they passed a slew of bills aimed at doula care, providing support for new mothers, and, continuing to expand access to abortion care. So where do those particular bills stand in the Assembly?
I think that we're going to see a lot of laws made, in this area. The governor made her, in her executive budget, in her State of the State, she indicated that she was going to make maternal care, maternal mortality, infant mortality, top issues, as well as she's always shown leadership on reproductive rights. And we together, the legislature and the governor together, I think will be looking at a lot of initiatives. A couple of my personal initiatives I'll mention, and that one that passed and became law just recently was to allow birth control pills to be sold over the counter. In a way that they've never been sold before at pharmacies, and we're going to see that making that much more accessible for people. Mm-hmm. I also have a bill for to make medication abortion over the counter, to simulate over the counter with a non-patient specific script. So that bill, I'm pushing very hard. There are countries like India which do it with no adverse impact on women, just making it more accessible. So we have emergency contraception accessible. We have birth control pills accessible. Hopefully soon we'll have medication abortion accessible, and make it so much easier for women to get the health care they need at a time that they need it.
Mm-hmm. And year after year, you do top the list of lawmakers who have been sponsoring bills that pass and a lot of them were signed into law, a lot of your bills. So what is your secret to being a lawmaker that continuously is the sponsor of bills that makes it over the finish line? What is the secret sauce?
Every bill has its individual path. You know, I mean, there's a lot of organizational skills, I think, more than anything else. I come back to that. But it's really following each bill's path, and I have a very terrific staff that also works closely on all of the bills. But you know, every bill has a secret sauce, and that's really what you have to think about. You know, and it's relationship building. It's being nice to people in the legislature, right. You know, and hoping that you can convince them of your bill. You know, so if you are nice and kind and you look at each bill's secret sauce, right. You know, you can have a great deal of success.
And your predecessor, we know, was Health Committee chair for a very long time, and you came on to be the chair of the Health Committee last year. So what was that transition like?
It's still tough. I will never be Dick Gottfried. He was something very special and knew this area so much better than I'm ever going to know it. But I'm doing the best I can, and I have the great fortune of being able to rely on him because he's still there. He's still in my life. He's still a phone call away for any time I have a question. So we're working hard to be half of what Dick was, and I'll take that.
And what kind of legacy are you hoping to have as Health Committee chair?
So I think if I pass Aiden dying this year, I will be very, very content to have that as a legacy element. And, you know, there's some things that need to happen. We need to deal with the workforce shortage. We need to reform our EMS system. Those are some of the things that I'm hoping to tackle.
Well, there's a lot to look forward to, but we'll leave it here for now. Thank you so much for joining us
today. Thank you for having me.
And we were speaking with Assembly Health Committee Chair Amy Paulin.